Well, hello and welcome to Uncommon Knowledge for Seniors. I'm your host, Jim Moran, a realtor and banking executive with over 35 years of experience. This podcast is your go-to resource for navigating the complex world of real estate and senior living transitions. Each week, we'll dive into topics and resources that matter the most to you, from retirement communities, real estate planning, to reverse mortgages, trusts, memory care, elder abuse, and more. And whether you're a senior, a family member, caregiver, or a real estate professional, we're here to provide you with the most valuable insights and practical trustworthy advice from some of the best experts in the business. Thank you for joining us, and let's get started. Well, good morning and welcome to another session of Uncommon Knowledge for Seniors. Today we have Michelle Thomas. Michelle Thomas runs a great operation called Fall River Health, and she's here today to talk about the different Medicare and Medicaid programs that she has available to her. And Michelle, thank you for being here today.
It is my pleasure. I'm excited. Medicare is not a terribly sexy topic, and it doesn't get as much airtime as it deserves. So thank you for inviting me along. I'm delighted.
Well, great. There's so much to talk about with this, and I know it's just such a deep subject, and it's confusing for a lot of people, and which is it brings you to what you do, and thank God for that, because you can represent the different programs that are available to people, and I'm amazed at the variety of things out there. But how do you manage that? How do you determine who's going to be best for what, and all that kind of thing?
Boy, it's a lot, and it's a moving target from year to year. So it used to be pretty just stale. So it was stagnant. Years ago, if you had a Medicare plan, or if you had a retiree plan, you didn't mess with it. Once you had it, it was in place, it was fixed. You may look at it every few years. That's definitely changed. It's something that you want to review on an annual basis. I know that's not a lot of fun, but hopefully you have a broker or somebody that can help you with that process. It's just a moving target. There's a lot of changes beginning this year, in 2025. So we're getting ready for the open enrollment period this fall. There's huge impacts to Medicare being changed based on the Inflation Reduction Act that President Biden signed. And all of our drug plans, most of our Medicare Advantage plans are going to take some pretty deep changes and deep cuts. So if there's a year to pay attention, this is it. And if you haven't reviewed in a while, it's a good idea too.
So what's the advantage of an Advantage plan versus the regular plans that you have?
So
what does that look like in essence?
What are the Medicare Advantage plans? So they're not for everybody. I mean, everybody has different needs, different, health needs, budget needs, location needs. We have a lot of snowbirds, and sometimes the Medicare Advantage plans may not play well in other areas. With the Medicare Advantage plans, typically very, very, very low premiums, if a premium at all. I mean, there's several available nationally that are a zero premium, which is really hard for folks to get their head around, because it just seems nothing's free. Nothing's ever free. And it's funded behind the scenes. So they are receiving compensation. It's just coming from Medicare opposed to you. Oftentimes the Medicare Advantage plans may have a somewhat limited provider network, meaning they're going to ask you to see certain hospital systems or specific doctors, and typically those are local, like an Oregon policy or a Central Oregon policy, opposed to the Medigap policies are more expensive. They're without limitation in terms of who you can go see. As long as a provider accepts Medicare, they'll happily, see you wherever you happen to be. Kentucky, Hawaii, Arizona, it doesn't matter. The Medicare Advantage plans, despite being zero premium, they often come with a lot of perks. So dental, vision, some over-the-counter items. They very often include gym memberships, things like that. So that's the advantage part of the Medicare Advantage plans.
So it's kind of a get what you pay for type thing, right? I guess that's where it comes down to it, and based on what you really need to pay for or what you really anticipate you're going to need?
Well, and they're apples and oranges. So, I mean, it really pays to sit down with somebody. And I should back up just a little bit. So, I'm a Medicare only broker. So our agency, we're off of 4th Street. We're here in Bend. We're local. We're not a call center. We're not somebody who's calling you from Texas or Florida asking for your business and then you never chat with them again. We're local and we reach out to clients each year. There's 3 of us in the office and all we do is Medicare. So to address your earlier question, we live and breathe this. We are on the internet, on different webinars. All of the carriers offer different information. We also do a national certification, and that's a 6 or an 8-hour certification each year. Every one of our carriers, whether it's United Healthcare, Mutual of Omaha, Pacific Source, they all have annual recertifications. Each of those are probably 3 or 4 hours, and we work with, I bet 30 carriers. So we spend a couple months. I know that sounds nuts. We do most of it on nights and weekends, just staying apprised of what next year looks like. Because once you're in the throe of it, you kind of learn what like now we know what 2024 looks like, and we're just learning what 2025 changes are, and there's ample. So to answer your question, in terms of whether somebody should be looking at a Medigap policy or a Medicare Advantage plan, or even just to compare it to your existing retiree plan, there's some pretty big disruption in the PERS program for next year. So if you're a PERS member, you'll want to take a look at that and maybe talk to a local broker and just see if the PERS system is still a good fit for you. And that's what we do. We sit down with everybody one-on-one. We see what you have. If there's room for improvement, we might take a look at it. But if what you have is working for you, we say, keep it in place.
So you have to really dig into their background and their circumstances and really what they're trying to achieve. And once again, how do people find you? I think that's the other question. I think there's so many people are perhaps unaware of the service you offer, and I think that's another thing we should probably talk about.
Sure, we're pretty involved in the community. So if you've chatted with SHIBA, the Senior Health Insurance Benefit Administration, just any of the senior outreach programs, a lot of the medical facilities, believe it or not, will send folks our way, word of mouth. People tell their neighbors and friends and family. We don't do a lot of advertising because we're so involved in the community that typically, we just did a health fair at the senior center at Larkspur a couple of weeks ago, and we're going to do the actual Deschutes County Fair soon. And we send out an annual letter each year, and just kind of to remind you, to just kind of poke you on the shoulder that, hey, it's that time to take a peek. And that's when we review things like, did you buy a second home? So, we realtors send us a lot of clients because you're moving to town, and oftentimes your Medicare plans, believe it or not, are based on your zip code. The policies you have access to are zip code based. So if you're moving from Eugene, Oregon to Bend, Oregon, your policy may not transfer. So you need to review that and just make sure that it's still adequate, that you can see our local providers and that you're not stuck only seeing providers back in your hometown. But that's when we look at things like, do you have access to VA benefits? And should you be taking advantage of that? And we just kind of dig in, and everybody's an individual meeting and an individual needs and budget and health needs and all those things. So we take those into account.
Seniors, boomers can be a pretty skeptical bunch and
Sure.
run into it all the time in the real estate business and the mortgage side of things. And I know you do too. And sometimes it takes a while to develop that trust, basically, to even talk about their finances and backgrounds and that kind of thing. And I think it's a cultural thing, and I don't see it getting much better. And I wish it was, but how do you get past that other than just taking the time, I think, to really sit down and talk to somebody one-on-one. Is that?
Well, that's pretty much how we get started. We chat with folks in person. If you have, a child, a sibling, a neighbor, if you have somebody that you want to come with you, a husband, of course, spouse, that you'd like to participate in the initial meeting. And it's a comfort level. Not everybody's for everybody. So you may meet with one of us here in the office and we're not your style. And maybe you meet with somebody else and that's a better fit for you. Just somebody that you feel that you can open up and share with. Don't ever share anything you're not comfortable with, but there's a certain degree of things that we do need to know, like which prescriptions are you taking, which doctor do you see, things to some degree, health history. If you're a cancer survivor and you're worried about that showing up in your future, just telling us things like that so we can kind of help you plan and predict, some future needs to the extent that that's possible.
Well, I guess the possibilities are endless. It's just a matter of getting the right one in the right place for the right person to do the right things. And isn't that true? It's just about everything. It's
Yes,
just,
sir.
It's just a matter of getting to that point. And I know from experience, having worked with you for a long time, that that's exactly what happens. And it was just so transparent and obvious. And this is what you need to do. And this is what my suggestion is. And going forward with that. And it was just such a high integrity process that I think it was it's so great to have. And for myself, I really, didn't know about you before I knew about you. But, it's right? Something that I think everybody needs to have. Are you just Oregon, or can you do national? Or are you national? How does that demographic kind of thing work, or the geographic?
We work in several states. I'm sorry to interrupt. We work in several states. So, of course, the West Coast, Oregon, Washington, California. We have a lot of folks that are snowbirds in Arizona, Utah, Idaho. So we're licensed in several states, and the states that we represent, we're very well acquainted with. I will say that typically you're best served working with a local broker, because they may know nuances. If you move to St. George, Utah, I may not know all the specifics. In fact, I'm probably not going to. So working with, if it's a snowbird situation where you spend a little bit of time in St. George and you just want to make sure you're covered for the big stuff, emergencies, urgent care, things like that, very different. But if you permanently move outside of the state, I'll connect you with another person like me that's a Medicare broker that typically I prefer to work with just folks that work with only Medicare like I do. There's so much. I'm always amazed when you can go to a home and auto gentleman who has your home, your investments, your Medicare, your everything all in one. Bless them. I don't know how they keep up with everything, but in the age of very specific expertise brokers, I would say you typically do better going with somebody who's going to know your local hospital system, or, oh, you love Dr. Smith. Well, he doesn't really like this plan. Let's switch you to a different policy.
We hear a lot about the life flight things, the put you in a helicopter and take you to wherever you need to go, or get you and all that kind of thing. Is that something that is that like an entirely separate thing, or can it be part of the Advantage program, or how does that fit?
So that's a goofy benefit. So here's how it works. Medicare, per the law, they're only required to cover what your ground transport would be. So let's say you were airlifted from Bend to Portland. Typically, per the law, they're only supposed to pay, or only obligated to pay, what the ground transport would have been. I've never seen them decline AirLife ever, and I've been doing this 30-something years. the Medicare Advantage plans all include that. That's bundled in with all of them. You'll have a copay. So let's say you work with Regents or Providence or Pacific Source. You may have a $300 copay for that ride, but darn it, that's pretty darn good in the scheme of things. But yes, there's coverage for it.
Okay. That's such a big deal around here with the mountains and all that kind of thing, isn't it? So good. Well, Michelle, we need to do this again, and I want to get into more detail on some of the things that we can talk about that might be a benefit. And how do people get a hold of you? I'm going to have your information in the show notes. But what's the best way? Sometimes are you like a fancy French restaurant? You need to make a reservation months in advance, or are you fairly available when on that level?
That's why there's three of us, that you can always get with one of us, whether it's in person and whatever your comfort level is. If you prefer Zoom or if you prefer a phone call or in person, we accommodate however it works. The annual election period, which is often known as the open enrollment period, starts October 1st. It runs through December 7th. And if there's one takeaway from all of this, if you don't have a broker, doesn't have to be us, but if you don't have a broker, reach out to somebody locally, because this year, and hopefully, Jim, we can chat about the 2025 drug plan changes and all of that, because everything, it's like massive changes. So it would be a really nice opportunity to take a peek. But for us personally, so our agency name is Fall River Health Insurance. We're not in Fall River, we're in Bend. We're on 4th Street, right across from the little yacht club, Midtown Yacht Club, that food cart lot. And just give us the ring. Our number is very easy. It's 541-388-3333. And it's myself, Michelle Thomas, there's Kelly Schroeder, and Michaela Bullock. And reaching any one of us, we do exactly the same thing, and we would be delighted to chat with you.
Well, you're a gift, Michelle, and I'm glad to know there's three of you. I didn't know that. I thought, well, it didn't start out that way, right? You were just...
We're growing.
Hey, thanks for this. And we do need to get back about that. That's probably sooner than later, about the changes coming up, and that's obviously a big deal, and folks need to know about that. So let's figure out a time to make that happen again.
I'd love it. Thank you.
Sure.
And thank you for including me. I appreciate it. And I think I'm one of your handful of first guests. So I appreciate it very much, Jim. We've worked together for years, and you are an asset to the society. And anybody who's moving to or from Bend, Oregon should consult you, sir. You'll take good care of them.
Well, Michelle, thank you so much, and we'll talk again soon.
All right. Thanks, everybody.
Thank you for listening to this episode of Uncommon Knowledge for Seniors. I hope you found the information valuable and inspiring. And if you have topics or circumstances you'd like us to address, please let us know. And don't forget to subscribe to our podcast and visit our website. We're at www.uncommonknowledgeforseniors.com for more resources and to schedule a confidential consultation. And until next time, I'm Jim Moran, reminding you to embrace your next chapter with confidence and clarity. Take care.